Hi there, Dr. Gary here on the road. We are dental practice brokers. We sell dental practices nationwide. Today's topic is seller of a dental office says they can't afford their hygienist at $85 an hour. What should they do? We'll get into this. Now, as you know, we now have 10 employees. We're spread out in 25 states, and we're available to you 363 days a year. And we take off Christmas and Easter. So give us a call, 201-663-0935, or our website, dentalpracticeguide.com, or nationwidedentalpracticebrokers.com. Give us a ring. Be happy to chat with you. Everything you're about to hear is for entertainment purposes only today. It's not legal advice. Now, if you have a larger practice that is grossing over 1.5 million chairs or more, please give us a call. If you're willing to stay on, work for 3 to 5 years, sometimes you may be a good candidate for a DSO. We work with 142 of them. We know who the best ones are. Often, they will pay our commission. So call us so we could talk about that. We've done that multiple times. In addition, if your practice does indeed sell for over $1 million and we're representing you, upon successful closing, based on some small criteria like using a dental attorney, we will often reimburse your legal fees upon successful closing. And we've done this multiple times. Just give us a ring and that will explain. All right, what is this dentist going to do? He says, hey, I can't afford $85 an hour, and that's what the hygienist is asking him for. So, I mean, certain hygienists, it's like, they're fantastic. I had some that were, very good with diagnosis or co-diagnosis, I'd say. And it worked out great for me, but the fees were a lot less. I retired 20 years ago. That was like $30, $28, $35 an hour. Those are the old days. So the dentist says, I don't know what to do. I just don't know what to do under these circumstances. So we had a chat, and he said, due to the fact he's a heavy participant in the PPO dentistry with reduced fees, he's not getting the cash flow. And $85 an hour is at the top of the scale that I'm aware of, as I see around the country. And so he's having trouble making a profit on that. I suggested sometimes what you could do is have the hygienist participate in as a percentage of what they produce rather than an hourly pay. And that could work out fairly well for some of you. The hygienist is happy and probably wind up with more than $85 an hour, and it works out for cash flow for the dentist. So an idea would be to try that out, try that percentage out, and see if that works. Now, most hygienists won't work for a percentage. However, some will, but it might be an alternative to at least get you, get you rolling. And I think that's what should happen. That's my suggestion. Other times, there's a number of dentists, more and more dentists, that are doing the hygiene themselves. So, it depends. But this dentist is not working out. If the hygienist doesn't have won't negotiate, and his PPO fees are so low. Now, an alternative is get away from the PPOs. Start doing your marketing and advertising and that could work out for you to start getting more fee-for-service. Now it pays for everybody. And I'm a firm believer in that. Again, I never did these PPO dentistry. So it's something that you may want to, different alternatives that you may want to try. But this dentist is serious. He's having trouble with this. He's not the only one. The PPO fees have not kept up with the cost of the overhead in dentists. Just haven't kept up. So this is something you have to really consider. And see if you can find a hygienist that will work on a percentage. See if you can start moving towards more and more fee-for-service. It's an alternative. Because right now it's not working for this one dentist, and he's not the only one. Other dentists are having this trouble. So I would suggest you try those two methods. It could work out well for you. Excuse me, I'm in an intersection. Don't like to talk when I'm in an intersection. Thank you for listening. Hit the subscribe button. You'll get updated information from us constantly. Thank you so much. Bye.